Welcome to the latest podcast from the Plastic Surgery Journal Club. Each month we review and appraise a journal article, typically from PRS, and summarize it for you in this short podcast. The full journal can be obtained from the PRS website.
Welcome back to the Plastic and Reconstructive Surgery podcast from the July 27, 2016 Journal Club. My name is Damien Marici and I'm talking with Dr. Harith Alani from the Children's Hospital at Westmead. Harith, the next paper which we looked at was multi-site lymphaticovenular bypass using supermicrosurgery technique for lymphedema management in lower lymphedema cases. This is out of both Tokyo and China and was published in the July 2016 PRS. So what was this paper about, Harith?
All right, it's a retrospective therapeutic case series in which 84 patients with lower limb lymphedema were surgically treated by multiple lymphaticovenous anastomosis. As you know, that the management of lymphedemas can be either physiological or excisional, and this is one of the important ways of physiological management. Preoperatively, the patient lymphatic status was assessed by using the lymphoscintigraphy and by endocyanine green lymphography, and the lymphatic vessels were classified according to the NECST classification system. Operations were done under local anesthetic with multiple anastomotic sites in different areas, followed by post-operative compression. They checked the patient post-operatively looking for the reduction in the volume. So they checked the limb circumference and they found that it's reduced in about 47.7% of the cases. They interviewed the patient looking for any improvement in the subjective symptoms, and they found that there is improvement in 61% of the patients. And they also compared the incidence of cellulitis pre and post-operatively, and they found it reduced also post-operatively. The result also showed that more significant volume reduction in advanced stages of lymphedema. So the more advanced the case, the more the response will be with this technique. So I think it's one of the interesting studies because it's discussing one of the difficult issues in plastic surgery, which is management of lymphedema, and trying to find criteria for successful lymphaticovenous anastomosis. Discuss more than one aspect of the outcome: the limb volume, the subjective feeling, and the incidence of infection. However, cases who ended with secondary surgical intervention within 6 months after anastomosis were excluded from the study, and I think that might affect the final outcome.
Because one would assume that they're going to be the ones which have failed treatment.
Yeah, and that it required urgent surgery within a few months.
Yeah.
25% of the patient have some exacerbation. And it would be better to mention more technical details about such surgery. It's not one of the commonly done surgeries, and it will be more beneficial if we go into the details, fine details of this technique and how to do it. But at the end, I think it's a multi-site lymphaticovenous anastomosis can be one of the effective ways in lower limb lymphedema management.
Yeah, certainly. Look, there has been a lot of plastic surgery interest in the management of lymphedema. Lymph node transfer is certainly something which is increasingly performed, as well as obviously more traditional debulking procedures. This paper does seem to have some surprising results in the sense that patients who are at a higher stage, a worse stage, actually got a better result, which would seem to be counterintuitive. As one would imagine that people with a worse stage of lymphedema would have an obliterated lymphatic system that would not be amenable to lymphaticovenular bypass. But certainly their results were impressive. A 50% improvement rate is great. But I would imagine that future comparative trials comparing this technique with the lymph node transfer technique might be something of interest.
Thank you for listening. For more of our podcasts, head to soundcloud.com or subscribe to us on iTunes and search Plastic Surgery Journals. Remember to like us on Facebook and follow us on Twitter. Thanks also to the PRS Journal team for their ongoing support.